Hi, thank you for tuning in to Global Elite Academy. Please press like, subscribe, and share this audio with someone who you may think need it. Today we're going to do Michigan. What do you need to open a non-medical home health agency in Michigan? Now, if you want to do our do-it-yourself program to start your own home health, non-medical home health agency, or if you need one-on-one help, go to globaleliteacademy.net. That's globaleliteacademy.net. You'll see both programs there. The one program is to do it yourself. You go through the training course yourself. At the end, you'll sign up for your policy and procedure manual and your IHSS manual. The program plus the manuals is $2,500. If you want the one-on-one program, that means we'll have a class with you. We will contact you. You can send us an email and tell us you're interested in the one-on-one class, and we'll send you an email. That class is taken twice a week. We kind of try to go through your schedule, 4 hours a day. And the class usually lasts for a couple of months. If you're in a city that needs license, we help you get your license for the IHSS program, and your non-medical license. If you don't need a license, then we help you set up everything else. If you're in a state that don't need a license, the rate is $12,500. If you're in a state that needs a license, then it's $15,500. We stick with you for several months, help you get patients. We actually just do step by step, help you register your business, help you get your website. We get your website, your brochure, and we just help you step by step. Just call us and we'll give you more information. Go to globaleliteacademy.net. Now, this week we're going to do Michigan. So now in Michigan is a non-regulated state. So you don't need license to open a non-medical home health agency in Michigan. But Michigan does have the IHSS program, which is called the In-Home Support Service. Like I've been saying every week, it's a program that's a community-based program, but paid for by Medicaid. Now, in Michigan, this program is called Home Help Program. That's Home Help Program. It's administered by the Michigan Department of Health and Human Services. It provides personal care service to individuals who need assistance with activity of daily living. The Home Health Program allows individuals to hire someone, including family members, but it's excluding your legal guardian or your spouse, to provide care in your home. The program is funded, like I said, by Michigan Medicaid. So here's a breakdown of the services. The personal care service, the program covers assistance with activity of daily living, which is ADLs, such as eating, bathing, dressing, grooming, and mobility. It helps you with activity of daily living, more complex tasks as you might have. Maybe you're not mobile, or you need transfer with a Hoy lift or something like that. It does laundry, light housekeeping. Now, for your family caregivers, because like I said, you can hire your families. The program allows individuals to hire a family member or a friend to provide care and receive comprehensive for their service. The program is part of Michigan's Medicaid service, meaning it is funded by Medicaid funds and available to those who qualify. Michigan has a no wrong door policy, meaning that individuals who are accepted into any state program will be referred to other programs that can assist them, including home health programs. So if there's other programs that you will definitely be referred to that. Now, in some of these programs that they have, like IHSS, there's also, I only talk about IHSS, but along with these community-based programs, there's also other programs that's connected with that. Some of the programs may allow short hours. Like there may be some that maybe only give up to 4 hours a day. IHSS, they'll give you short and long hours. So if you needed somebody for 4 hours, you could get that. Or if you needed somebody for 12 hours a day, you could get that. Even if you needed somebody 24 hours a day, they'll also give you that. I mean, the hours are like unlimited. But then they have other programs, like I said, that only give you maybe they'll only give you 4 hours a day. So it depends on your needs, what you need. So you would have to contact, if you're a patient, you would have to apply for it, and then they would, give you what you're qualified in getting. But if I'm right now talking to agencies, so if you want to open up an agency and have the IHSS, which in Michigan is called again Home Help Program, you will be able to get it. So what you have to figure out, it also has a program, these home community-based programs also have a part where they will do like disability. If you're a disability patient, you can for the agency, if you're a disability, then they do have some community-based program for disability patients as well, and also for children. The children, like there's a program that provide help to children up to 18 years of age. If you are a home health agency, you have to decide what program you want to take. Sometimes the caregivers that we advertise out here for, some of them don't have experience with disabled, and some of them don't have experience with children. Most of them do have experience with the elderly. So when you do your interview, when you hire caregivers, you want to make sure that you're checking their reference and you're checking their qualifications. Because it is against the law to give out any personal information about a caregiver that have worked with your company, so people will only give like the date that they worked there. I would always send out a form, fax them a form, have the caregiver sign it to get the reference, and then I would have questions on there like, are they dependable? Is this reliable? But the number one thing I would put, is this caregiver rehireable? If they put they would not hire back this caregiver, there was a problem with that caregiver. And, they don't want to say. If they say they will hire them back, then 9 times out of 10, there was no problem, and you can hire that caregiver. There's an agency, one of my agencies, that one of my clients that I've trained to open up an agency in Colorado. She had a problem with a caregiver, and it was like on a Monday, and so that Tuesday she had hired the caregiver. I'm sorry, fired the caregiver. The caregiver told her, "That's nothing. I've been had another job by Friday." You see, these caregivers know that they go from agency to agency, and a lot of these agencies are not even checking their reference. So you want to make sure you're checking these caregivers' reference and experience, because it's such a shortage out here. People don't even be checking their experience. If the caregiver approaches your agency and say they're looking for a job, and then they say, "Well, I used to take care of my grandma. I don't have any working experience, but I used to take care of my grandmother." These agencies hire them. When I had my agency, I never hired people who worked for their family, because to me, that's not a job. You're going to react different with your family than you do with people who are not your family. So if somebody called my agency looking for a job and then told me, "Oh, I worked with my grandmother," I would always say, "Okay, no, that wasn't enough experience." They had to have at least 1 year of professional experience. And some of these caregivers will just say because I know this one girl told me that she just told the agency that she worked for her grandmother. But the truth of the fact is, she was a truck driver, and her truck had broke down. And she was trying to get the money to get her truck fixed. And she told me caregiving was paying the most, where she could, get the most salary and the quickest that she could get the money to be able to get her truck repaired. So these people be lying. They do. So you have to always remember, you're sending these caregivers in other people's home. Make sure that you're sending the right people into someone else's home. This one agency told me that they hired this girl. She was in another state. She was from Michigan, and she went out to Colorado to visit. So she worked while she was out there. She worked for this one patient. She stole his credit card and racked up almost $5,000 on his credit card for things for her little girl. And then when they found out, she quit and went back to Michigan somewhere. You have to be careful. You are sending other people, these patients are entrusting you to do background check on these people and send them in their home. You need to act like it's your home and really, really investigate these people before you send them out in somebody else's home. Okay, so that's how you open up an agency in Michigan. That's what you need to do. Those are you want to always have IHSS, because that's care for people who can't really afford your services. And then private pay is people who can, usually millionaires that can afford your services. So you want to make sure you're taking private pay, insurance, and long-term insurance, which is under private pay, and IHSS. So thank you again. Those are the qualifications to open up an agency in Michigan. Have a good week. Bye.